Facebook Live with the University of Chicago Medicine. My name's Tim Brown, and joining me today is Dr. Emily Landon. Welcome. Hi. And Dr. Allison Bartlett.
Hello.
Thanks for being here, guys.
Our pleasure.
And today we're going to talk about the flu, and we're going to answer your questions. So if you have any questions, please just jump right there on Facebook as you watch and type your questions in. We'll do our best to have one of these experts answer them. Let's just get right started on this, and let's talk a little bit about the flu. And I think a lot of people get confused when they think of the flu. They think of, well, maybe I have a cold, maybe I have something else. What is the difference between the flu and a cold, and how can you tell?
I'm happy to start with that one. So the flu and colds are both caused by viruses. So they're kinds of infections that are not treated with antibiotics. They're related kinds of viruses, but really the difference to people is what kind of symptoms you have. So when you get a cold, you get a runny nose, you might get a little bit of fever, maybe a little bit of body aches. But when you get the flu, you really know it. You get cough, sore throat, really high fevers, intense body aches, feeling like you got run over by a truck.
Yeah.
And it's the kind of thing that lasts for a while, right?
Yeah, so it's like one day you're feeling pretty good and maybe a little sore throat, and then the next day you wonder which marathon you ran overnight while you were sleeping, because you can't really get out of bed, and it just drags on and it drags on. And even when you're better, even after the cold is gone, or the sort of the fever and the feeling of the runny nose and all that stuff is gone, and the cough is better, you're still exhausted. It sometimes takes people 3 or 4 weeks to really be back to feeling normal again.
Yeah, and this year it seems like a particularly brutal year for the flu. We've heard about hundreds of cases, literally, just here at UChicago Medicine, which is more than we normally have. And it's been making the headlines. We've heard about fatalities. I mean, it's been a tough year. Why is this season so bad?
The vaccine this year isn't as effective as it is in other years, and there are a lot of reasons for that. And we can get into it if anybody wants to talk about that today, but suffice it to say, everybody expected and hoped the flu vaccine would be more effective, but when it's not very effective and you have a flu like H3N2 is a subtype of flu that spreads a little bit more effectively and is a little worse than the other kinds, and so not as many people immune, you can have a lot more people get sick, and when you have a lot more people get sick, the rare events happen a little bit more frequently, and you end up with more people sick. And the more people that are sick, the more people they can spread it to, and it just kind of gets out of control pretty quickly.
And we've seen a lot of cases here.
We have seen a lot more cases than we have before, and every week we keep hoping that this is the week when the numbers are going to start trending down. But since the end of December, we've really been at a steady, solid level of cases. Fortunately, most of the patients that we see here don't end up in the hospital. They get tested in the clinics and the emergency rooms. And appropriately, many patients who come in with flu-like symptoms aren't getting tested. It's flu season. You have flu-like symptoms. We can make the diagnosis without having to test you and can help with supportive care.
And of course, if you do have the flu, if you're diagnosed, or even if you think you have the flu, stay home.
Absolutely.
Yeah, so I'm going to say that's a really big point for people to remember. We can't pass the flu on to other people if we aren't around other people. And so hanging out alone is a good idea when you've got the flu. You're doing everyone a favor.
Well, and I think, we live in a culture where people want to power through and go to work no matter what, or go to school. And I've been there, and I've had coworkers that have tried to do that. Everybody has an important job.
Yes.
But the key is don't pass it along, because you can make a lot of people sick.
Yeah. So over the past couple years, the word presenteeism has come into our language, and that's exactly what it is. Whether our jobs are actually important or not, we have colleagues and coworkers who rely on us, and we feel bad if we're not pulling our own weight and we're staying home because we're sick.
Or we need the paycheck.
Yep.
Absolutely. And the smarter thing to do is stay home and take care of yourself and return when you are feeling better, and that keeps all of your colleagues and coworkers safe and able to do their jobs as well.
And overexerting yourself when you have influenza is not the best idea. The flu it doesn't just feel different than having a cold, It is different. It's a more severe virus. There's more likely to be a bad outcome. People don't die every year of the common cold unless they have a lot of very severe underlying medical conditions. But even healthy people can die of the flu.
We want to remind people that you can send your questions in through Facebook Live. Just type them in, and we will do our best to have one of our experts answer your questions. So please send those in. We do have a few that we prepared and that we got in advance as well. So one of the questions was, how much longer will the flu season last? And that's probably a tough one.
I would love to know the answer to that. Like I said, every week we keep hoping it's the last. Historically, the flu season does wind down end of May, beginning of April. We started a little earlier this year than we have in the past. Whether that means we end early or just have an extra long season, we don't know. But unfortunately, it does not look like there's an end in sight right now.
Starting in March or April, we usually see fewer people getting the flu every week, which is an important milestone, right? So the end of flu season is probably, you're not going to be like checking it off on a calendar, but when you start seeing less cases every week, that feels good.
It's interesting. You were mentioning a moment ago how important rest is when you have the flu, and it's, and I'm not going to say who this person is because it'll get me in a lot of trouble when I get home, but somebody close to me had the flu recently and was diagnosed by the doctor, and she was making the comment that she was feeling a little better, so she wanted to go work out. And I said, don't do that. You need to rest and let yourself recuperate and get better. She went and worked out anyway and then felt bad afterwards. So the key is rest.
It is. You've got to give yourself permission to take care of yourself and heal and get better, which again in this fast-paced world is a luxury that we don't often afford ourselves.
Well, what do people do to actually stay healthy? What
to avoid the flu?
Yeah, what are some things people do?
Yeah, so I think I think it makes sense to me. I'm just going to say, clean your hands, clean your hands, clean your hands, clean your hands. We'll just start there.
Yes.
Your hands are how you get, most times people catch the flu from off of surfaces. People cough and sneeze and then droplets land on surfaces and that's got the flu on it. You touch it inadvertently and then people actually touch their face a lot without realizing it. And not cleaning your hands before you eat, that sort of thing, not great. But the other thing we can do is people cough and there's influenza in the cough. And that's how a lot of people catch the flu. So any distance you can put between yourself and the person that's coughing is good. So if you're stuck on a busy train, even leaning back might be able to help cut the chances of you picking up the flu. I don't know. What do you?
Yeah, I think those are the highlights. And then we start from the very young ages teaching kids in school to cough into their elbow, do the sort of Dracula thing, everything that you can do to help sharing secretions with other people and getting them on you. And it would be great if there was a fancy newfangled invention or something, but really it's good old-fashioned hand washing.
Well, one of the things here at UChicago Medicine, as you two are both well aware, we talk about foaming in and foaming out, which is hand hygiene, using the hygiene machines. But people can do basically the same thing at home by buying there's various products out there that are hand that you can use to clean your hands, so just keep some of that with you. I have some in my car even. Yeah,
hand sanitizer kills the flu virus really well.
Yep.
And the one thing I'd say is make sure you get enough on your hand and that you get all the parts of your hand. Sometimes we forget our little fingertips because we're busy rubbing it on the palms. And so make sure you get your fingertips and make sure kids get fingertips. It's safe for kids to use hand sanitizer too, and they think it's fun.
Yes, absolutely.
Now we have a question from one of our Facebook viewers. That's great. Thank you, Tara, for writing in with your question. Many are concerned about mercury and aluminum in flu shots. Is there any truth to this? Is it a concern?
The amount of mercury, we use thimerosal-free vaccine here, which is the mercury that you're thinking of. In some places you might find some thimerosal containing mercury, but the amount of thimerosal is so small it doesn't actually cause any problems for people. But you should be able to get thimerosal-free vaccine. I don't think it's a concern. I think dying of the flu is a lot bigger concern.
Yeah, I second that absolutely. And the mercury in thimerosal is different than most of the mercury that we worry about with exposure to fish and other products as well. So just a second, what Dr. Landon said, the flu is much worse than any potential risk from the vaccine.
Yeah, you're getting a lot more mercury from eating a piece of salmon probably than you are from even a thimerosal containing vaccine.
Interesting. interesting.
Yeah.
That's good information. And thanks for the question, Tara. We've got one from Andrew now. Thanks for sending these questions in. We appreciate it. Andrew says or asks, when trying to figure out which strand of flu will be prevalent during the season, what kind of input do you all have in the process? And maybe that's kind of the greater you all as far as university and medical centers.
There is a committee that's tasked with charging it. One of my colleagues who just retired was on the committee for years and years, but it is sort of national flu experts who get together, and based on the past year, what little information we may have from what's going on in the southern hemisphere, they get together and make a very educated guess.
Yeah, flu likes to. Remember, it's winter in the southern hemisphere when it's our summer, and so they're having their flu season, and that's the flu that sort of makes its way up usually to the northern hemisphere. So you can take a lot of clues from there. We don't formulate our own flu vaccines here. It's done for the whole world. Actually, there's one committee that sort of decides on this for the and then the manufacturers make flu vaccine. But there's more to getting it right than just picking the right strain.
Sure.
And that, I think, is a piece that it's kind of hard to understand, because when the way they grow the flu virus in order to make the vaccines themselves have killed virus in them, so you can't actually get the flu from the flu shot.
I'm glad you say that, because every year we hear that from
big
people.
question.
Oh, I got the flu from my flu shot. You can't.
You can't, but they have to grow the virus in order to make it inactivate it and kill it. And the way that they grow it can have something to do with how well our immune systems respond to it. The process of growing it actually ends up sometimes shifting the virus just a tiny bit, but that can sometimes be enough to cause it to not work as well. And that's really what happened in Australia, and then what happened to the vaccine this year.
It is, and in particular, that's one of the reasons people think that the vaccine doesn't work as well in general against this H3N2 strain that we have for a variety of reasons. That is one that doesn't stay faithful when it replicates in eggs as it's being grown.
That's very interesting. Is it too late to get a flu shot?
That's never too late.
It would have been better to get one a few months ago, but it's never too late.
Yeah, and when we talk about getting the flu shot, we always hear about there are certain segments of the population that is probably more important for them to get, the elderly and the very young, but it really is important for everyone to do it.
I agree. The fewer people that have the flu, then the fewer people that they're going to spread it to. So the more people, it seems like it's simple and we shouldn't have to say it, but if fewer people have the flu, then they can't give it to as many people. And that means the immunocompromised people and people in whom the flu vaccine doesn't work very well, or babies that are too small to get the flu vaccine, can be protected because there's less flu circulating overall.
There are certainly groups of people who are more at risk for severe complications when they get the flu, but by getting everyone vaccinated, that's how you can protect them.
Kathy, one of our Facebook viewers right now, and I'm so sorry, Kathy, this has been a rough couple of weeks for you. She's been down with influenza B for 2 weeks now, and her question is, when is she going to feel better? And again, I think this shows just how rough the flu can be, because it can really lay you up for a long time.
Yeah, my 12-year-old neighbor had the flu A, a couple of weeks ago, and his fever went away, and he said he was feeling a lot better, and he goes, how long until I'm going to be back to normal? And I said, at least 3 weeks. And he comes home from school and he says, I'm still not back to my regular self. I'm really tired at school. And I say, you still got another while to go. So I usually say about 3 weeks, but if you're immunocompromised or if you had a particularly severe bout of the flu, it could be even longer.
It can be. And the other thing that we always need to be mindful of is the flu itself can last 3 weeks, but certainly the flu sets you up for a secondary complication infection with bacteria. So what we unfortunately see with some people is they have their severe week-long bout of flu, and then they're better for a little while, and the fever comes back, and breathing problems develop, and they can have a pneumonia that, in that case, may require antibiotic treatment.
Yeah, the double sickening, that's an important one to watch out for. So if you're at home with the flu and you get better, and you're getting better, even if it's real slow, that's okay. But if you get sicker again, that's a problem, and you want to see the doctor immediately.
And Kathy, you were diagnosed with influenza B, so I'm assuming you went to a doctor to get that diagnosis. probably the nasal swab, I would imagine, which everybody loves. It's
yeah. There's actually two kinds of tests, and there is some concern about this. They both like require you to have something stuck up your nose, which is bad, but could be worse. But one of them is a special PCR test that actually looks for the DNA of the virus, and that's a pretty good test. And then there's one that's a rapid flu test, and that one's not as good. It looks like it might be missing a lot of people with flu. So if you're really sick and you just got one of these rapid flus, don't just assume, and it was negative, it could still be the flu. And we're just starting to understand that that test isn't quite as good as we wanted it to be.
We would like it to be better, and it's...
Yeah, we don't use that test here, but a lot of places do.
Well, I'm wondering if she was tested, if she would have been given
Flu
something.
B, she would have gotten the fancy test.
Okay.
Because they can't tell the difference.
But would she have been given anything, like any kind of prescription?
Yeah, so, yeah.
You go for it.
Yeah, so we use Tamiflu a lot for flu. It's a medication, that's a brand name. Oseltamivir is the generic name. And it's a really good pill that can help prevent complications. It can shorten the lifespan of the flu. And if you're at very high risk of complications of the flu and you get exposed to someone with the flu, the Tamiflu medicine can keep you from getting sick. And we use it in our healthcare providers a lot here to help prevent them from getting sick when they've been exposed to patients because they didn't realize the person had the flu and they didn't wear a mask, that sort of thing. And so we can prevent people from getting sick because we really don't want sick healthcare providers. It's
absolutely not. So I was kind of curious if Kathy had been given that, and if so, that speeds the healing process somewhat, right?
Yeah, it will.
It does. It shortens the course of your illness for about a day, and it has, I think, an important impact as well that we don't have quantified quite as well of making you shed less. So it makes you less contagious faster. So when we think about your risk of spreading to other people, there's a benefit there as well.
Great. So advice for parents whose children might have the flu. I mean, that's tough, and it's tough when the adults have it, but you know, when you're caring for the little ones,
it really is. And you know, kids who are in school or daycare like mine are and were get sick all the time, and they get runny noses and they get fevers and they whine and feel tired. And I've had the experience before where I'm sort of blowing off what my kids are saying, and then a couple days later I get it and I realize that they were not just whining for the sake of whining, they were really feeling loud.
I think we've all done that.
But the things that we worry most about in kids and make us want to, you know, call a doctor is very high fever for 4 days or longer. Look at how they're breathing, and if they're breathing fast and breathing hard, that's the real warning sign. And the other things that we look for in kids are things that we look for all of their illnesses. Are they able to drink enough? I don't care if they lose their appetite and they're not eating food. They're not going to waste away in a couple days. But if they're not drinking and not making wet diapers, and if they're not waking up and being as alert as usual, those are the warning signs that we worry about.
Is dehydration a big issue with the flu?
It can be. You feel lousy. You're actually probably need to drink more because you're having a fever and you're sweating. Some of these, so one of the symptoms of flu can be a sore throat, which is not going to make you want to drink more. And so dehydration can be a significant problem.
And some people do have GI stuff.
Absolutely.
Like the
especially kids.
throwing up and diarrhea.
Yep.
And it can make things really confusing as to whether your kid came home with or you came home with the winter vomiting bug thing, or if you have the flu, and it can be tricky.
Yeah.
Kathy had a follow-up question for us, and she asks if she should wear a mask when she returns to work.
That is a very thoughtful question, and I applaud you for asking it. The rules that we use here in our healthcare setting are a little bit stricter than we use in the general community. The general rule is if you've been fever-free for 24 hours without taking any medicine to reduce your fever, then you are safe to go back to work. If you're having a lot of coughing, then it would be a nice idea to cough into your arm and sort of cover that. But in a healthcare setting, we actually have people stay out for 7 days because that's when we expect them to be less contagious.
The majority of the spread of influenza happens actually sometime between the 24 hours before you get a fever, which is really tricky, and about 4 or 5 days after the fever starts. So that's the time frame in which you're most likely to spread influenza. If it's been a couple of weeks, you're probably not going to pass any influenza on to other people, even if the effects are still, if your body's still recovering from all the damage the flu virus did to you, but you're probably not spreading very much to other people. Now, in people that have very poor immune systems, either because of a disease or a medication that you're taking, you can spread that flu. That flu can stick around in you for a lot longer. And so if you work with people that are really immunocompromised, it might be important to wear a mask or to avoid working with them. And if you are really immunocompromised and you're still lingering on at the couple weeks mark, then it might be reasonable to return to your doctor and just see how things are going.
And we have some flu restrictions in place right now here at on the medical campus, which when we do that, there are folks out there that, it's an inconvenience. We certainly realize that. We're not doing it to try to inconvenience anyone or be mean, but it's to protect the patients. And it's a very real threat for a lot of our patients.
It is, and it really is it's a difficult decision to make, because having your loved ones there with you while you're in the hospital is very important to your recovery. As a pediatrician, we feel it, especially because you've got brothers and sisters that you want to be able to come visit. But we know that one of the populations that we restrict is children who are under 12, and they are more likely to have the flu and not know it or be spreading it for a long time after they recover, and can put their sick sibling and the other patients in the hospital at risk.
Yeah. We've already touched on this somewhat, but I want to ask it again and more directly, because I think it's very important. If you're at home and you're feeling rotten, when do you get to the point where you need to actually seek professional help?
So I think Dr. Bartlett talked a lot about what to do with children, and I'm going to address what to do with adults.
Great.
If you are sick with the flu and you have the typical symptoms of the flu, like what it says when you Google influenza, you're probably good, right? But if you're having trouble breathing, if your fever isn't breaking, if you're having trouble getting out, if you're so sick that you can't even really just get out of bed to make yourself a cup of soup, if you're not doing these small tasks around the house, if you find yourself too tired to get up and drink water, get water to drink, that's a problem. If your breathing is so short that you can't walk down the hallway, you're in trouble. And if you're coughing so much that you can't get through a sentence, that's a problem. I mean, everybody has coughing, everybody with the flu has these coughing spurts where you couldn't talk during that. But if you're coughing so much that you can't get through a conversation on the phone, you may need to go back and see your doctor. To review, shortness of breath, really bad coughing, so tired and achy that you can't walk around, and fever that just won't go away, just won't break, symptoms that are worsening after 4 or 5 days. The other people that should probably seek medical attention if they think they have the flu, even if they're not that sick yet, is anybody with a medical condition that might change your immune system. So if you're taking medicine that makes your immune system not work as well because you have an autoimmune disease or you're taking steroids or something like that, you need to see your doctor for even a fever. And people with cancer or with other conditions that might lower your immune system, or with a primary immunodeficiency, you need to go to your doctor, even if you are feeling not so bad, because flu can sneak up on you in that case and start to cause problems and not make you feel nearly as sick as it should in the beginning.
We have a question from Todd, one of our Facebook viewers, and Todd asks, is the flu shot bad for IgA deficient children?
The flu shot should not have any impact on kids with IgA deficiency. Anything that we can do to help bolster their immune system is great, and the flu vaccine works building your IgG immunity, a different related kind, so it should work just as well in kids with an IgA deficiency.
Great. So another question I had, and we talked, you touched on this briefly, but the length of time that folks are actually contagious, and it's kind of difficult to tell when you get it. First of all, you might have it for a while and think you have something else, a cold, and are ramping up to it. So it's difficult to tell how long you're contagious, but give it a shot.
So I think, as Dr. Landon said, really the tricky part is the sort of 24-hour period before you know you're sick, that there is a risk of being contagious. But really those first day or two after you are very symptomatic are the most likely times to shed, but you're still able to be contagious as a otherwise healthy adult for 4 to 5 days. Again, immunocompromised people, little kids can have virus that's able to be caught by somebody else for weeks.
So like in Kathy's instance, situation, she's had it for a couple of weeks. Even if she's starting to feel better, she might still be contagious for a few days.
Well, it depends on what Kathy. We don't know anything about you, Kathy.
Yeah, sorry,
we don't know about
we're not trying to.
And you
diagnose
don't need to
over
tell us.
Facebook,
And you don't. Yeah, you don't need to tell us.
you can if you want. She's been giving us good information so far. But
yeah, so if Kathy's immune system's normal,
Yep.
then she's probably not contagious anymore.
Okay,
She's
great.
just
recovering.
suffering. She's recovering from the damage. So viruses work by causing damage to our cells.
Yep.
They literally kill our cells. In the lab, when we look for viruses growing in culture, we grow them in human cells and then look to see if any of the cells died.
Mm-hmm.
That's how we know they're there, because they're too small for us to see. So the flu virus gets in, it kills all these respiratory cells, it kills lots of other cells, it makes your immune system go haywire. You make all these chemicals to fight off to attract white blood cells to fight off the flu. And those chemicals make you feel sick. And as long as they're there, and as long as they're fighting off the flu, and as long as those cells have to be repaired, you're going to be feeling kind of down.
Okay. So what's the best thing you can do for a friend or a family member who has the flu? That's
I guess,
a tough one.
I mean, it depends on the person, whatever they want, I guess. Help them.
Encourage them to take care of themselves. Remind them that they are an important person, but they also need to do self-care.
Help take care of their kids. Do whatever it is that they would be doing if they didn't have the flu, so they don't feel like they have to get back to doing it as quickly. Recognize that it can take many weeks. So what I would want if I had the flu, I would want somebody else to take my kid to school for me. That's what I would want.
I think so, and help with some cooking and maybe bring me the soup that's going to make me feel better.
Yeah.
I think those are nice suggestions. So we've only got about 2 or 3 minutes left. This half hour's gone by very quickly. We've got another question though, and this is from Lorna, and we talked a little bit near the first part of the show about how experts work to develop the vaccine, and the question is, how did the experts miscalculate the dominant flu strains this year? And again, tough question.
Yeah, they didn't.
Okay.
The flu strain that they used in the vaccine is exactly the right one. It matches perfectly. The problem is that it was grown in eggs, and like we said before, H3N2, when it's grown in eggs, it shifts just a little bit, and that little bit is enough for our immune system to be really great at recognizing the virus grown in eggs and not so great at the virus that's actually causing problems in humans.
Yeah, and I think it just brings to light the need for continued scientific investigation into a flu vaccine that's not targeting the parts of the flu that change every year and focus on what they call a universal flu vaccine that will get all kinds of flus, and we don't have to make our annual guesses about what the right ones are, and potentially not have to get a flu shot every year.
There you go. So what's the best TV show to binge watch when you're home laying on the couch trying to get over the flu?
Brooklyn Nine-Nine. I love that show.
Do you?
I binge watched that show the last time I was sick, but not this year. I didn't get the flu yet this year.
Good.
That's right. Yeah, I'm an all things NCIS person, I have to say. I'm a happy
I've
ending
never
person.
actually seen any of those. Maybe I should binge watch that next time.
Well, maybe you should. Guys, we've used our half hour. That went by very quickly. You did a fantastic job.
Yeah,
Thank you.
thanks.
It was our pleasure.
Thanks for the great questions.
And it was so much fun to have you participate on the other side of Facebook. So we really appreciate that. This was fun. We ought to do this more often. And we probably will. I think we're going to do more of these Facebook Lives in the future. So keep your eye on the UChicago Medicine Facebook page, and we'll advertise those if we come up on them in the future. And we certainly appreciate people writing in with their questions. That's all the time we have. I want to thank Dr. Emily Landon and Dr. Allison Bartlett. Again, thanks for being here, and thanks for watching. And we'll see you next time.